Hi, welcome to MD Newsline podcast. Thank you so much for joining us. Please introduce yourself to our audience.
I'm Dr. Michael Robers. I'm a multiple sclerosis specialist and neurologist and neuroimmunologist in Phoenix, Arizona at Barrow Neurological Institute.
Great. So, you gave a talk here at the conference about hypertension and its impact on multiple sclerosis and health disparity, but I'm so interested in finding out how you came to do this work in the first place.
Yeah, I've always been interested in health disparities even before I knew I wanted to go into neurology, actually. I view medicine as a service to the community, and one of the biggest concerns that we have in US healthcare is communities that aren't maintaining their optimal health and achieving their optimal health in part because of poor access to care or other social and structural factors that are then modifiable. And so that's always been an interest for me. And then specifically, when I became a neurologist, when I became involved in multiple sclerosis has known health disparities where not everyone with MS has the same disease course. And specifically in the United States, there is evidence to support that Black Americans, Hispanic Americans, and Indigenous Americans all have potentially worse outcomes than white Americans with MS. And that's not fully understood why. And so that's an area of research that I trained in and when I was at University of Southern California with Liliana Mesqua, who does a lot of Hispanic American research. And now that I'm back in Phoenix and at Barrow Neurological Institute, I'm trying to kind of expand the availability of that research to our local Phoenix community.
hmm So, when you say worse outcomes, are people who are a part of the African American population getting MS more often, or are they being diagnosed at later stages? What do the disparities kind of look like?
Yeah. So, when I say disparities, what I'm referring to is disability, and that can be measured in different ways. So, most commonly, it's talking about physical disability, like walking and things like that. But there's also evidence about increased cognitive difficulties, which we know many people with multiple sclerosis end up having cognitive difficulties, but that seems to occur faster and earlier in Black Americans who have MS. And the full reasons are not fully understood. Part of that might be underdiagnosis
Mm.
initially. So it used to be thought that multiple sclerosis was predominantly a quote unquote white person's disease. There are certain populations in Northern Europe and Scandinavia that have very high rates, and that's where that came from. But within the United States, everyone living with similar risk factors, most recent studies have actually indicated that. Black women and white women in the United States have very similar rates of multiple sclerosis, with some studies actually indicating that Black women had higher rates of multiple sclerosis than white women, even. Although looking at the large data, I'd say it's safest to say they're similar, but it's certainly not a white predominant disease. And so, if that is the case, then for years we've likely been underdiagnosing multiple sclerosis in minority populations. But there is also possibilities that despite equal diagnosis, if you diagnose people at the same time, that there's actually worse progression of the disease and inflammation. And that can be attributed to many different factors that are not fully understood yet.
Mhm.